We give providers an unbelievable capability to really, really help patients, and it's going to improve healthcare all the way around. Today, a lot of the AI solutions out there, you'll hear about them automating some paper process that saves time, and that's great. But moving towards this ability to equip providers with more information at the right time, at the right place, I think it's going to be the thing that changes healthcare. We've all wanted to improve healthcare for a long time. I think this is going to be the thing that actually does it.
Welcome to AI in Healthcare. My name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, also known as the Young Doc on social news media. And I am super excited about this episode because, believe it or not, it is actually one of the biggest reasons that people started tuning in to my whole education stuff thing on social media as it relates to labs and explaining how labs can be complicated because it can be normal to be abnormal. And also, you can have normal labs that are still obvious based on where you live and stand at your baseline that you may have an underlying problem, like iron deficiency or B12 deficiency, folate deficiency, a kidney problem, you name it. Now, what are the reasons that it is not uniform on why patients receive the same kind of investigation or care or workup based on labs? Well, the answer is complicated. And that's what we're going to talk about today with David Norris, who has literally found and seen this kind of administrative burden notion, which is when you hear it at first, you're thinking, oh, well, yeah, there's a lot of clicks and retrieval of information and documentation. But what he's really focused on and what we're going to talk about applies to all of us as providers and as patients and as loved one of patients. And that's basically, it is unbelievably overwhelming to, one, do the documentation, but two, the labs that continue to come into your inbox. And when you live in a reactive world where things that are really big problems always take precedence, what happens to the things that are tinier, smaller, more nuanced problems that, aren't life-threatening? Is that okay? Is it okay to miss those things? We are going to discuss how AI can actually help kind of not only flag, but clue in providers into things that would start in almost a preventative way. And like I said, we've talked about it so many times, CBCs and CMPs and the size of red blood cells, all of this stuff has insight. It's just a matter of how much can be kind of gotten to or the system has time for. So with all of that said, I'm very excited to introduce David Norris. David, thank you for being here.
It's great to be here. Thanks for the nice introduction.
Yeah. So, I on the previous recording, we had tech issues. I was like, he's a gentleman. And I can tell you're a gentleman just from our pre-call because you just have that kind of feel of compassion or empathy. And I wonder, was that what kind of stemmed your recognition or realization of how truly cantankerous, rigid, and difficult and unadaptive our current system is on how we can actually, one, know what to do, but two, even know the things about you to be able to even start doing the things that we want to do to make your life better? How did that all kind of unfold for you?
Well, yeah, I've been in healthcare for 20 years, and as a patient and the consumer of healthcare, we all know the system can be quite challenging. So I have a huge amount of empathy for providers because I think they have an incredibly difficult job. And right now, with the advent of all of this new AI technology, I'm more excited than ever because the opportunity to make a real dent in healthcare and actually improve the system is greater than it's ever been. So if there was ever a time to be in healthcare and actually help, this is the time.
So I get the sense you almost salivate on saying, Sanjay, as a guy that can really appreciate systems and workflows and all of the like, you're almost just like hungrily seeing different capacities or verticals within the healthcare system that can be optimized with the technology of AI. I'm gonna put you on the spot for a second because I haven't asked anyone this, even though we've recorded a few episodes. Tell us, or anyone that's listening that may not know, about AI down to its like real under the engine, why are people excited about AI? Like, what is it about it that just is so promising that it's going to be transformative?
Well, the really interesting thing for those of us that have been in tech, and I started programming when I was 12, so I've been in tech my whole life.
I couldn't read it.
Well, it's actually a pretty exciting time, but AI has been around for 20 years, and people have been working on AI for a long time. I built two companies before that both used AI in machine learning. What's really come about that's different with and everybody's used ChatGPT. When ChatGPT came out and the concept of LLMs, the opportunity to attack a broader set of problems became very, very clear. And over the last couple of years, there have been more companies started than any time prior to now, especially in healthcare, because the opportunity to leverage this new technology is so exciting. What it can do for us is pretty broad. It can do everything from trying to take manual kind of administrative processes that people do today that take away from being able to care for patients directly. And we can actually give those to AI and let it go do those things. Some of them are really mundane, like as everybody knows in healthcare, we still do a lot of faxes, right? Everybody faxes stuff everywhere. Well, somebody's got to read those faxes, and AI can do a pretty good job of doing that. And obviously things like rescheduling appointments or being able to follow up, all of those kind of things that historically have taken time, AI can now do. It can even go as far as, we're working on some really cool technology to take an AI agent to actually call you on the phone and talk to you and explain things like lab results to you. 5 years ago, that seemed very far-fetched. Today, that's actually reality.
And is it's so exciting, but I'm sure anyone listening is like, so what happened? Did you make a robot? Is it the fact that we finally got this whole, these LLMs, these language models? Is it because we finally got it right to where it can actually understand what our needs are and that we can communicate it accurately and then actually go do it? Is it that? Or is this one the bigger one, that it actually has this insane computational power to do things in parallel, meaning where I have to do things more one-dimensionally? I have to go look at the patient, I have to look at my schedule, and then I have to then be able to think, what do they need treatment or not? When in the treatment room, how long will it take? So I have to have them in the morning if it's going to take 6 hours because our clinic closes at 5. I have to do all those things in a row. And I believe it's like the parallel functioning of in a second that it's able to do that, and also understands very well what those considerations are that I can just pin, and then all of a sudden it always knows that. So are those a couple of things? Is there something I'm missing on really why or what is so just promising and insane about what is, capable of doing?
Well, I think, there's a bunch of enablers that made this happen. If you think about the sheer processing capabilities that are now available, that was a key enabler to be able to do what was done. So OpenAI introduced ChatGPT, but most people think of it as ChatGPT like 3.5 when it first came out and could do these things, but there were prior versions. The problem is the computing power was not significant enough to enable it to do things that begin to mimic human intelligence. So as you get more and more processing capabilities, and these large language models were introduced to be able to take a huge amount of data, like the entire internet, and digest that, and then be able to respond in ways that seem really intelligent. All of us go in and we play with ChatGPT, and you ask it questions, and wow, it can answer everything. It's like an online encyclopedia. That's what really enabled all of this to occur. So you can now go to ChatGPT and say, hey, I have this condition and this condition and this condition. What could it be? And it can actually go digest the world's information and come back with a reasonably well distilled set of options. And that wasn't really feasible 10 years ago. Even 5 years ago, it was difficult. And today it's reality. And tomorrow it's going to get even better. So if you've seen some of the new stuff that's going on with reasoning, it's incredible. And voice is the big thing. AI agents that can talk to you and have a conversation where it becomes difficult for you to determine it's not a human. And that's where all of this is going. And I think a lot of people are worried about this is going to take jobs and things like that. In healthcare, we need more nurses, right? We don't need nurses doing paperwork. We need them seeing patients. So what AI is going to do is going to enable caregivers and providers of all types to be able to spend more time with patients and not do those things that we don't want them doing, right? We don't want them doing paperwork. You ever go into a doctor's office and the doctor's sitting behind the computer typing while you're talking to them? It's like, no, don't do that. Talk to me. And that's now possible with ambient AI. The computer and AI agents can actually take notes for you. And that's the way it should be.
1000%. I'm just going to go ahead and say it because I get asked a lot. It's like, So you're saying they go replace doctors? I think it's a matter of semantics. I think in some way, in a large way, it will replace doctors for a lot of the things doctors do. Does the role and need of a doctor go away? No, I think that's timeless, and that's why it's been around forever. It may be on more of a qualitative appreciation of what is suffering, right? And those metrics that the AI is able to retrieve and say these are the options, and this is what you can do, and these are the best suited dosing, parameters based on X, Y, and Z. Sure, but I don't know. It'll be some time before you can measure the qualitative lift. Like, what is the human being lift of this chemo regimen or what have you? And I know you're not trying to replace the physician, but what you are trying to do, as you beautifully said, was how do I just make sure that the human aspect of medicine doesn't continue to get lost? And that's what you're seeking out today is like, and I'm curious, what are those things? What are the things that you see in front of you and are just like, this one can go, this one can go, this can be substituted, this IT, or sorry, tech and innovation can handle? What are some of those things that you get excited about that currently are truly problematic?
There's a lot of them. I think the most exciting things to me are the relationship between a provider and a patient. So I'll give an example. I have a pup, and I take a pup to a vet, and I get a checkup. What happens? 3 days later, the vet calls me, "Hey, how's Wolfie doing? How's that medicine working?" Have you ever had that happen with a provider? No. Why? Because providers don't have time. Providers are buried. And what we've done in healthcare is we've sort of moved into a mode of when you're sick, call the doctor, right? Well, it would be nice if it was the other way around, where you actually had a relationship with your provider and they helped keep you healthy rather than treating you when you were sick. I think that occurs in other industries, but in healthcare, it hasn't. Now, value-based care is beginning to shift things that direction, but I think AI is going to have the most profound impact where we can establish, maintain, and enrich a relationship between the provider and the patient so that patients don't, put up with that pain for an extra 6 months and it turns into some catastrophic problem, but rather let your provider know right when you have it, and then you can actually try to prevent it from getting worse. That is what I really want to have happen from AI.
And the way you see that happening fairly quickly is to just take away a lot of the time monopolization that occurs with everything that's outside of that. So that the hope is, because with cancer, we have, 4-6 week wait times, right? So before they can even get the cancer managed. But even in a preventative sense, in a primary sense, you're like, let me take out a lot of the burden to free up and let breathe the time to have attention to things, not just in a best case scenario for today reactive manner, but a preventative and fostered relationship manner.
Exactly. Yeah. Well, that's one of the things we're doing at Affineon. We attacked one of the problems where if you look at where does a doctor spend a lot of time every day, and a PCP will spend a couple of hours every day in their clinical inbox, and it's very different than you and I's inbox. I mean, we get a lot of mail and email and stuff, but a doctor's getting lab results, patient messages, prescription renewals, but they're getting hundreds of things every day. And unfortunately, they can't wait till Saturday to catch up like sometimes we do. They have, literally patient lab results coming in and they need to get back to those. So what most doctors end up doing is they get up early and they spend a little time in the inbox and then they squeeze in a little bit between patients and then they stay up late at night trying to catch up. And then the next day it starts again. And what that does is it kind of wears down doctors. After a while, you're just running as fast as you can run and it just becomes tiresome. And that's creating burnout with physicians. And that's a pretty big problem. Right now, there's a projected shortage of about 100,000 doctors in 2030. And if you imagine, like today, it's pretty hard to get an appointment. Imagine what it'll be like with a shortage like that. So we're attacking the inbox problem using AI to help providers to get through their inbox faster and equipping them to do a better job. And I think that's the key with AI. If you can put the key pieces of information out on the table so the doctor can see them easily, they can make a great decision. And AI has this ability to digest a huge volume of data and surface the things that's really important for the provider so they can use their clinical expertise in the right area rather than worrying about doing some mundane thing that's not going to help a patient. And I think that's really where AI can shine.
So you're speaking on maybe labs specifically because, correct? Is that what you're alluding to?
Yeah.
Because I mean, I'll tell you, that's my wife and I, she's also an oncologist. Every single night for the last 6 years is kids go down, 9 p.m., laptops open, and we are working on notes and going through inboxes until we literally fall asleep with a laptop on our lap. Every time, every single night. And you're exactly right with Saturday and Sundays. Who's watching the kids on which day so that the other person can literally sit down, take 3 coffees, and try to catch up on all the documentation and the labs and everything else. I took the first Harvard AI strategies and implementation course, AI in healthcare, and my capstone project was actually exactly that as it relates to something as what I think as a hematologist. So that's one of my specialties is a CBC. Like I can look at a CBC and immediately know based on not just by itself, but even by itself a lot of times, but especially before, if there's an iron deficiency that developed, a B12 deficiency, a folate. I'm always talking about B12 because metformin, which a lot of Americans are on, because I personally think it's a good drug, 30% will get B12 deficient over chronic use. But guess what? They're also diabetics. So there's so many patients that are being told they're neuropathies from worsening diabetes, even though their A1C is 5.5 or 6. And now starting to get a little of the central nervous, stuff. And nobody has noticed that they're B12 deficient. And there's two things. One, it could just be a big cell. But two, if there's a bigness that occurred from their baseline, then it's still cluing you in, even if it's not going to get flagged in Epic or whatever, because it's not necessarily big enough. So obviously, as a hematologist teaching people, I'm like, look, this is obvious. Like there's a standard deviation of increase in the size or decrease in the size. I could do that all day. But right now, my box is all the CLL patients that I'm watching that have lymphocyte counts or white counts of 30,000, 40,000, flag, 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 flag every time. Every CKD patient that lives at a creatinine of 1.8, flag, 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 flag. So obviously the flag stuff is just useless when you're seeing 20 patients a day, like my wife and I are, and especially cancer patients where there is, I freak out about every liver number and kidney number and sodium because immune therapy alone can cause sodium shifts because of brain stuff. Lung cancer can cause, it's endless.
Yep.
So I'm obsessed with this thought, and I don't know why it hasn't happened yet, to be honest, on how can you just start whacking away at the stuff that a hematologist will be able to tell you, a nephrologist looking at the sodium and chloride changes over time, and the bicarbonate, which always tells me sleep apnea, at least makes me think about it when it's going up for no reason. People are like, oh, I don't know. And then I start questioning, not as their primary. Sure enough, sleep apnea is full blown, right?
Yeah.
And then the obesity was justified that they couldn't get it off. Anyway, I could go on forever about this. So you're helping this situation. Am I hearing you correctly?
Exactly. So imagine this scenario. If every provider could have a dedicated assistant to triage their inbox, and they could tell that assistant, hey, do these things. And when you see this, I want to see it. Otherwise, you take care of it. That would be great. But obviously, budgets won't allow that. So what we've done is we created an AI agent that costs $2.50 a day. And it will triage your inbox 24 hours a day, 7 days a week. And it'll implement the protocols that you tell it to implement. So you can say, hey, if things are normal, I want you to handle these normal labs, but not if something moves, like let's say you have a PSA and it moves a lot, but still within the normal range. Well, I want to see that. So we've actually programmed an AI agent to do that, to implement a set of protocols and act like your assistant, but actually handle those. And we can handle clinically insignificant abnormals. And then for those that are really abnormal, we go through and analyze the lab and insert things that would be super helpful, like you mentioned, like a CKD calculation or an ASCVD. We actually put that in, we summarize the labs, we trend them, and all of that's prepared for you. So now when you sit down to go through those clinically significant abnormals, you can go through them a lot faster because we're surfacing the things that are clinically significant to you. And by doing that, you now can actually think about more important things. It's just exactly like surfacing or sort of putting a spotlight on things. We can digest the entire 10 years of history for a patient. We can digest the entire set of lab panels, and we can bring that to you in a way that you can now really, really help that patient. And before you didn't have that, right? How long would you take to read 10 years of history on a patient? It's long. We can do that in 3 seconds. So we can actually surface that.
That's just so incredible because one of my big kind of soapboxes has always been iron deficiency. And there's been a couple of publications or two now that have come out that in young females, it actually shows not only a morbidity, but mortality difference to be iron deficient even without anemia. So meaning your hemoglobin is normal, your hematocrit's normal, but iron deficiency, we know for decades, causes irritability, depression, fatigue that just can't be explained, restless legs at night that keep people, from being able to fall asleep. And literally they're on 3 central acting agents, sedators that keep them, kind of, out of it the whole next day. All of this without recognizing simply iron deficiency. Because again, if somebody lives at the size of a 93 is the MCV we use like for red blood cells, that's normal. But if somebody is 78 or 76 and loves steak, they might be able to keep themselves afloat to not get anemic. But if they're looking at 78 and 93, they're both normal. And you would just never know unless you see a hematologist. And if the hematologist has time to listen to you and hear about all those things that you're talking about, when oftentimes we're also handling the cancer patient, right? And that's extraordinary, because then you can have all this validation on why, these things should be checked or considered in settings that are overextended. I don't think it's going to put any kind of guilt or blame on primary doctors, because primary doctors are a colossal amount of work that they have to do, and they have to triage the scariest stuff first, the most reactive stuff first. Why are you on oxygen? You're telling me something that's a normal CBC, but actually like turns out to be iron deficiency that somebody carries the symptoms of for years. It's still so qualitatively insulting, or detrimental. And I think that's unbelievably exciting, because on top of that, it can actually go to the whole premise of preventative stuff. Because, and I did this to myself, but when I see an iron deficiency patient, my question is why, right? Because you don't just get iron deficient without getting, small bowel surgery, or if you have cycles, sure. But if you always had cycles and all of a sudden you're deficient, that's still weird. If you're a male, I go the whole way. I check urine, I check for blood, I check the colonoscopy. You have to do this, but you're not going to get penalized. The current way right now, nobody's going to know that you missed that until it was a problem, right? Because it was too hard to tell. But the truth is, if you had all data to figure it out, you could.
Well, that's where AI can help. Again, it's like having a dedicated assistant that can speed read, right? I mean, think about that. If you had your own MA student sitting there and they could literally do whatever you wanted them to do, nonstop, every day, 24 hours a day, that's what AI is like. And I think people's impression about AI, it's no different than any other tool. We now have MRIs. We have all kinds of machines that can do things that help us as providers. The question is AI going to take over the world? No, it's going to be another tool. We'll use it appropriately, and it will level up providers because they don't have to do those things that don't really require their clinical expertise. They can focus on the things that matter. And that's absolutely going to make a difference in healthcare. That's why I'm so excited, because we have this amazing new tool.
I'm super pumped. So I have 2 questions. I'm gonna let you take your choice on which one you do first. One, I want to know, what are some of these examples, like outside of a CBC, but say like, the renal function, everything that you're talking about. But number 2, my second question would be, as I'm sure that some people are thinking, is it a perpetuation of inherent biases? Or I would go a step further and say lack of competency, because if the provider is, the mind doesn't know what the eyes haven't seen. If they're the ones actually putting in the stuff, they might not know that MCV difference of, a delta of whatever it may be matters. How are you solving that problem? Or do you want the easier one, which is what are some of the labs and other things in the inbox that you're fixing?
Well, we'll do both. So on the lab side, we've done over 2,000 different types of labs today. So we can handle, and we've had to train the system to do this. So we use clinicians to help teach the system, how do you do a urine culture? And believe it or not, there are about 35 different options for a urine culture for what you do next. And that's not obvious. And there's no place you can just go get off the shelf knowledge. So we had to actually train the system to do that. So training for 2,000 different types of labs to be able to effectively know, based on what kind of patient and what kind of result you get back, what do you do next? That's complicated. It is in our case, we have an amazing clinical team that help do that. And I think that's how you help providers. You take that set of learnings and then you give providers this powerful tool. And then in our system, we actually have the ability to suggest possible actions. And certainly a lot of practices these days are adding APPs, they'll add an NP or a PA to help take care of patients. And those may not have the depth of experience that an MD has. So they really appreciate this idea that AI can suggest for this patient, for this set of labs, here's a set of things that you might consider to do next. And that's an ability for AI to kind of level up all kinds of providers, APPs as well as MDs, to give them a superhuman tool. And that's exactly how I think of it, is you want to equip those people with the best information and then make suggestions, and then the providers can make a decision about what makes actually the most sense. So I think that's the real power of AI. And in our case, it's hard to train AI to do all of this, but once you do, it's an incredible tool.
No, I mean, for sure. It's just, one of the examples I think of immediately is with chemo. Sometimes, if I'm especially moonlighting or doing something with tele stuff, I'm seeing that sometimes chemos, and I'm talking life-saving, if it's a curative, setting, are being delayed repeatedly well beyond the half-life of the drug and how much that the patient has sustained, saying that there is suppression of the counts because of the chemo. So delay another week. And it's because the hemoglobin's just not going up, right? Or some of the other things. And that kind of flag in the mind of, wait, I know my eyes are already trained to anticipate a drop, but then I might shut off the other reasons for the drop to be able to say, like, wait a second, it might be iron deficiency. And by the way, or folate B12 deficiency, because they had a small bowel cancer, and because their albumin's dropping, which is cluing me in that, that they're not eating, even though their weight may be not as dramatic. Why? Because when your albumin drops, then you start third spacing fluid. So there you have this time period where your weight doesn't change that much, but the stuff that holds the fluid inside your blood vessels that only comes from nutrition is getting low. And for me personally, and I tell my residents and fellows exactly the same thing, this is where I want you to think about B12 and folate. I want you to then go back to the MCV and see what's happening there. And, it all kind of makes sense, but it just takes a lot of observation. Of course, we're fallible. On top of like a compassion-based thing or having the time, you're also just fallible. And the implications can be just so profound when you think about it, because like I said, in the world of cancer, we're talking about life-saving things.
Well, it's a really interesting example. So take a CBC as an example. So you as a hematologist, you're an expert. So imagine for the moment you could give your level of expertise to every PCP out there. So because every PCP out there is going to do an annual wellness visit. They're going to run a set of panels. They're going to do a CBC, but they may not know exactly what to watch for. So like your example of an iron deficiency, they might not catch that. So with AI now, we can help them to improve kind of the depth of their knowledge of hematology, where, they're in an impossible situation. They're trying to see 20 patients a day. They don't have that depth of knowledge, and now we can help them. So to me, that is an incredible power. And, we're not trying to make all providers equal or anything like that. We're just trying to give them the tools necessary for them to be able to diagnose. In many cases, PCPs are trying to tackle a pretty challenging problem, right? There's these weird set of symptoms. What is it? And without having to do a referral every time, they can now have incredible power at their fingertips. And that's just really what this is all about. I think your example of a CBC is perfect. I mean, we do more CBCs than anything across 2,000 different lab types. CBC is number one because PCPs run it all the time. What they can detect from that varies a lot.
I'm thinking about another example of this one's tragic, is how many African Americans I have that go maybe 4 to 6 weeks terrified that they're dying of an illness because they're 23, 25, 30, just finally went to the doctor, and their white count, their neutrophils specifically, are low. Right. And they're 4 to 6 weeks because all my new cancers are the ones that are taking, 3 week times, because you have to triage. Cancer is imminently dangerous. Benign ethnic neutropenia, which I don't like the name, but that's just what it's called, is something that's benign, meaning like not life threatening, but it's terrifying on a CBC because we looked at a whole bunch of people, I'm told 70s, 80s sometime, and said that they look healthy and normal, so we're going to call this range normal. But 1 out of 4 to 1 out of 3 African Americans will have a chronically or consistently low neutrophil count. And on top of that, when they get a viral illness, it's not uncommon for them to get a paradoxical shift to where at least the percentage reads even lower because they have the lymphocytes coming up. And that's usually what happens. They go in, they see that the neutrophils are 600, even though they live at 900, both of which are low. And now it's like, are you sick because of your leukemia? Right. And this happens everywhere all the time. One, it's taking away from a hematologist oncologist, which is fine because like the placation of saying, yo, this is fine. You've had this in the past all the time, is one thing. But if that could go away, it wouldn't take up the time in that capacity. There wouldn't be the financial toxicity of seeing a specialist, right? Which causes us to have higher, premiums for payers. I mean, that's just one example, but it's still applicable to 1 out of 3 to 1 out of 4 African Americans, right? And so I can just see all of these subdivision templates of what and when and why, right? Like after chemos, on every 3-week chemo that neutrophil counts can take a big hit. You also know it's going to take a bigger hit with each one. And even if it's not to just make it go away, at least up front, because our NPs do our toxicity checks, then you can say this is within the realm of normal for the drop, for abnormal. And when you can start doing that, now you've just really opened the lid on how much monopoly and time is spent going through things to explain why this big drop is actually a normal abnormal. Like I use that phrase all the time in clinic because it's important for mental health. And that's just so unbelievably exciting to me to conceive and think about. Now I'm going to ask
the concept of normal. As we built this business, the concept of normal took on a whole new meaning. It's interesting because in the context of a specific patient with a specific condition, normal, especially across labs, normal isn't normal. It's very interesting. So I have a new level of appreciation for that, especially based on, the context of the patient. I mean, that's the real key, is taking a CBC in isolation is impossible. Right. I mean, what is the value? I mean, you have to know the patient, you have to know the history, you have to know what meds they're on, what kind of conditions they're dealing with. So that's what makes processing in labs really hard. And it is a complex task. And again, a great application for AI.
Another thing that you don't have to answer if you don't want to, but it kind of pains me. And I've never said this on 3 years of the podcast. I think we have a problem of over-administration of testosterone from low testosterone levels, right? And we know, I'm sure you know, that very much matters on what time of day you do this testosterone. Like we know that. This is simple physiology. But I've seen plenty of cases where, where men my age just didn't know that mattered, or didn't know that maybe having repeat testing, or that there needs to be an access evaluation for what cues in testosterone and what's happening to the adrenal corticoid and the anterior pituitary. Like none of that stuff's done. And they don't realize that they are forever going to be dependent on testosterone without some washout period to wake up their adrenals and start doing this. And when they say that, they get horrified, right? And then also, maybe that's not, maybe these aren't alleyways that you're, looking to uptake, but I think for the greater good, at one point, someday we'll be able to say, this is when it makes sense to do it. This is when it makes sense not to do it. This is when, in fact, they're turned out not to be testosterone deficient, because you have to have an explanation for that. I could see really helping. You said you didn't want to standardize or democratize. I'm going to push back and say maybe it's a good thing to recalibrate, kind of our practice behavior because of things that just weren't capable of giving us the insights from continuous longitudinal data that they can today.
Yeah. Well, this is where it's going. So if you look at over the next 5 years and say, where does AI go with healthcare? I think we really end up with these kind of tools. We give providers an unbelievable capability to really, really help patients. And it's going to improve healthcare all the way around. So while today a lot of the AI solutions out there, you'll hear about them automating some paper process that saves time. And that's great. Moving towards this ability to equip providers with more information at the right time, at the right place, I think it's going to be the thing that changes healthcare. We've all wanted to improve healthcare for a long time. I think this is going to be the thing that actually does it.
So I'm curious, and I'm afraid to ask this question, but I hope you're not met with resistance to adoption for things that can technically just kind of keep us more rigidly tight on not missing, the flyaway things that we know we're competent and capable of doing. It's just that we may have a time issue. It takes an admission of either time issue or overwhelmment, which all the statistics say is happening. But I'm afraid or wondering, are you face to face being told, hey, I got this, or we got this? And if that's not the case, what are some of the challenges that hopefully can be addressed as we move forward to be able to have? And I know a lot of patients listening to this are really kind of like, I would really like that. I'll tell you, that's the only reason I'm social media famous is because I just break down CBCs and CMPs and chemistry all the time. Like I'm just breaking them down. And then you'll see what makes you sick and not proud is now hundreds, if not thousands of comments that came months later and that said, I went to a fourth specialist because of this video, or I finally switched because of this video, and I cannot believe that I can have children now because they were severely iron deficient, or I cannot believe that I'm like able to be a mom again. And I mean, it doesn't feel good. It just actually feels nauseating. And I don't think it's because somebody's incompetent or reckless or whatever. I think it's so multifactorial. Time exhaustion, not that you're physically exhausted, there just isn't enough hours in the day, to also a reactive culture because you have to be, because those are the ones that matter. I mean, there's so many issues, but just read the comments and you'll see that people's lives are changing from just an explanation. So I would love personally to see, this is a big full circle celestial for me, because this is what I was passionate about. You have found the solution. How do we make sure that it's adopted and happens?
Well, luckily, in our experience with providers, they overwhelmingly want this new technology. We've got
Good.
no pushback at all. I think it's a lot like any other tool. They want the tool to work and be reliable, but they don't really care what's inside of it. You know, MRI machines have a lot of AI inside of them. Nobody cares. They just care that it gives you a good image. And I think that's what's happening here. When you talk about having an AI agent that can triage your inbox, they just go, thank goodness. You know, because I'd love to have an RN do it, but I just can't afford to hire an RN to dedicate to triage my inbox. So if AI can do it, and it can do it faster and better, a pretty cool solution. Labs coming in on a Sunday, our AI agent will triage them and will send the patient a note. Hey, congratulations, your labs are normal Sunday morning. And the patient's going, wow, this doctor's working on Sunday. You know, so the patients love it because they're getting quicker response. The doctors love it because that's what they would have done anyway. They would have looked at it and said, hey, your labs are normal. Congratulations. So now the patient's relieved and they don't have to wait a week to get some providers, very short note like, okay, your labs are normal. They don't typically spend a lot of time on those. So patients love it, providers love it, and we've seen nothing but just overwhelming adoption. And I think that's going to be the key here is providers just want help. They don't really care, is it AI, is it not AI? They just want something that works.
That's fantastic. I'm very relieved to hear that. And, I just think about the number of calls we get from just such a real place of concern by family members that it's random. You're seeing this patient for months and all of a sudden you get a call and they want the doctor to call back and explain every single red flag on the thing. And then you'd be like, well, as discussed with a family member, could say they're moving it, from elsewhere to take care of them. That's because of the chemo and I'm going to make that call every time. But I guarantee you, that's also why I don't make any of my kids' soccer games and like practices, because it's one or the other. And like you either have the doctor that will call you back, or you'll have a situation where you're just going to stress about these red things and think they're being ignored or not addressed, when in fact they are actually perfectly normally abnormal. And so I think this is something that can greatly reduce that. I mean, there's just so many, it's death by 1,000 paper cuts of the moral injury things that every individual, not provider, but individual, just on who they are and then their circumstances with everything, is making. This is just an ultimate neutralizer for that. So I'm super excited. Is there something that man, you don't have to give away the secret sauce, that you're headed toward outside of the CBC CMVs? If it's imaging, if it's, so you have ambient, you have the note writing, I assume probably something with prior auths, et cetera, justifications for iron infusions, which drives me nuts because let's say the ferritin high, I'm like, that's because they have cancer. Like it's an inflammatory reactant. There's so many things that I could go on about that I spend my time with in right to the patient.
Well, we have to tackle, a few things. So we're doing lab results. We're doing, prescription renewals, which also, vary for providers. We're introducing imaging next quarter. So that'll be a really nice thing. And we're focusing on the outbound, the communications with the patients, helping to close care gaps, getting patients to fulfill the lab orders we order for them that they don't always do, and that's really where we're going as a next step. So it'll be nice to be able to have AI helping to get patients more connected with providers and get them to do the things that the providers want them to do. and having doctors follow up with AI assistance is a whole opportunity, and that's where we're tackling.
What if someone's listening to this, excuse me, and wants this AI insight or training applied to their labs? Is there a patient-facing opt-in to be able to have and see the longitudinal data and maybe get a clue about something they still have unanswered?
It's a great question. Today, we really focus on the provider side, but I think it'd be really exciting to give patients and give the consumer this power. And that's something that we're not doing today, but I think it will definitely happen.
Excellent. Well, David, you are truly making a change, and I wish I met you before all these gray hairs from the way practice is today, but I think this could honestly change a lot of not only the burnout, not only the deficiency issues, but even like make people feel comfortable again about going into medicine, because truth be told, a lot of them are being told, like you don't get the time. It's not what it used to be. It's like a lot of administrative burden. And you're like, dude, F that, excuse my language, but you're like, there's no excuse for that when we have the tech that's capable.
Yeah, we want to get you to your kid's soccer game. That's our goal.
Oh,